Hello people, in this video let us look at renal calculi or renal stones or kidney stones. So many words are there here. So basically what are we looking at, guys? Stones in the kidney. So we are talking about the stones which could be in the calyx or in the pelvis, upper uretral possibly. Okay, ureteric stones we are not covering here, we are covering only kidney stones in the kidney. So basically these are more common in males, guys. But the infectious renal stones are more common in female. Okay, this if you want you can remember. Now, what are the clinical features? How will these people come to you? First of all, realize that they will have pain in the loin, abdominal pain basically. So loin is this area below your lower rib and above your hips, right? That is the loin, and here they will have pain. Okay, so where will the pain be? Abdominal pain. So they are saying in the hypochondriac region or in the lumbar region. Okay. So where and all are your quadrants? This one, this one, this one, this one. So instead of that we can say like this, something like this, right? So right kidney pain here, left kidney pain here. Very good. So these are the clinical features, symptoms you saw, right? For men, if this pain can be radiating to groin and testis. For women, it can radiate to labia majora. Okay, this can be associated with vomiting due to pylorospasm. And this pain actually worsens on movement, they are saying. Then there is some punch test to demonstrate renal angle. This looks scary anyways. Ureteric colic can be there because of hyperperistalsis from your kidney, right? From your kidney what is coming out? The ureter. So there could be ureteric colic. So because of the hyperperistalsis, hematuria, there can be blood in the urine. Some of these stones will cause blood in the urine, okay? Pyuria, pus in the urine, especially if it is an infection, then there can be pus in the urine. Guys, fever can be there, obviously if there is infection, etc. Now coming to signs, you can see, what did we say? Tenderness, abdominal tenderness we said, but do you know that there can be exactly where? There can be tenderness in the renal angle. So here's your renal angle they are showing you. And that's where your kidney is. See, this side you have the 12th rib and this side you have the erector spinae muscle. Which one is what? Superiorly you have the 12th rib, medially you have the erector spinae muscle, is it? Yes, how's it going, guys? So you're looking at clinical features of renal calculi, right? There can be guarding and rigidity. See, what do you mean by guarding? In medical terms, guarding and what is rigidity? The difference. Guarding is more like they will hold your hand against, when you're trying to check, they will hold it against, that is guarding, right? It is more like they will hold it. Rigidity is what? Rigidity is something that is in the inflamed area, and this you cannot overcome by asking the patient to relax. Some other things that you may find in these people are urinary tract infection. You can have some other metabolic disorder you can have, right, which is causing the stones. There can be hypertension also because the kidney is responsible for maintaining your blood pressure also, right? So there can be hypertension. Clinical features done. Now we will move to the etiology of renal stones. Okay. But anyways, let's take a recap of this clinical features. Pain. What else you saw? Pain that radiates right to groin testis in men, to labia majora in female. Right. Where will this pain be? In the over the renal angle, hypochondrium, lumbar regions. There can be hematuria, pyuria, fever. There will be tenderness in the renal angle. There can be guarding, rigidity, etc. They can have urinary tract infection, some metabolic disorders, or even hypertension. Okay. Now coming to etiology, guys, you have to remember that diet is a cause. See, people who have vitamin A deficiency, right? They can have desquamation of the epithelium, which can cause stones. This will be some Randall plaque theory also can kind of say about it, because they talk about erosion there. But anyways, park the idea, guys. Diet we're talking about vitamin A deficiency. Foods which are rich in oxalates like tea, cola, alcohol, etc. They are blaming some fruits also like citrus fruits. And why spinach? Because for everything we say spinach is good. I'm not sure why, but they have written here that spinach. Guys, what are we looking at? Renal stones, etiology, causes. Hot climate is a cause. They are talking about some decrease in colloids, etc. Then coming to citrate level, citrate level is good for you. But if there's decrease in citrate level, you can have kidney stones, guys. How does it work? It helps in this calcium phosphate, carbonate, the levels, okay, in soluble state, etc. Infection in kidney, guys, remember this. We told you the infection will be a cause of kidney stones, especially in women. And the organisms will be like E. coli, staphylococcus, streptococcus, proteus. This proteus, etc., what they will do, they will lead to staghorn calculi, etc. Remember, okay. Then prolonged immobilization. So what will happen when you're prolongedly immobilized? Let's say you're in bed rest. If you're in bed rest, your bones will start decalcifying, right? Your bones, they will start decalcifying. So where will the calcium come from? So your bones are there here. And let me draw a bone here. There's a bone here. Okay. There's a bone here. Now you're in bed rest. So what will happen? All the calcium will come out. Ca2 plus I have written. Okay. All the calcium is coming to the blood. So now if there's calcium in the blood, where will this go? To the kidney. And there what will happen? It has to process so much calcium. Then you will end up with kidney stones. So prolonged immobilization will cause decalcification of the bone, causes hypercalciuria. That is, urine also will have hypercalcium. So that can be stones. So you can see this continued here. No, what does this continued mean? That means the etiology is not over yet. One more slide is there. So metabolism. So some metabolic disorders there can be there. What will happen if you have hyperparathyroidism? If you have hyperparathyroidism, you have more calcium in the blood. Calcemia. So that will lead to hypercalciuria, right? So you will have bilateral stones, etc. Then gout. If you have gout, what will happen in gout? See, purine, when they break down, it's written here, you will have hypoxanthine, uric acid. So these uric acid can lead to, what can uric acid lead to? Yes, uric acid stones. So people who have gout, they'll have excess uric acid, so they can have uric acid stones, okay? And sometimes they can have xanthine stones, etc. Xanthine also possible. Just take a refresh. Where are we? We are looking at the causes of renal stones. We saw the diet is a cause, immobilization was a cause, then immobilization I'll write here. One more thing after this. After diet, what came? Think. Hot climate, citrate level, infection. Okay. So then we saw metabolism. We have seen till here gout. Now hyperoxaluria as a result of altered glycine metabolism. So oxaluria. So this will lead to oxalate. So that you can have oxalate stones, calcium oxalate, etc. So hyperoxaluria, then cysteinuria, then there will be cysteine stones. Okay. So everything they have explained here. Oxaluria, oxalate stones, cysteine stones, uric acid stones. This is calcium, right? Calcium oxalate, you can say. Calcium oxalate stones, calcium phosphate stones, etc. Continued etiology is still continued. Look at this continued here. What does that mean, guys? That means still we are continuing with the etiology, causes of stones. Okay, if you want a break, take a break, guys. Take a break. Okay. So, where are we here? So, stasis, what will happen due to obstruction of urine flow? If there is urine flow obstruction, so this is your kidney, there is a urine flow obstruction. So, what will happen? There will be stasis of urine. So, when there is stasis of urine, there can be, urine will accumulate here for so long that it can cause stones. So, supersaturation, crystallization and all, finally it will lead to stones. Actually, these people, we forgot to mention, guys, I forgot to mention, there can be mass in the loin. Loin is what? From the lowest rib to the hip here, they'll have pain, right? There can be a mass here. This mass can be because of hydronephrosis, guys. That is the backflow of the urine, right? Because of this urine stasis. What will happen? There can be mass in the loin. This is because the kidney has swollen. Because of all this urine backflow, this kidney has swollen. Can you see the kidney? Please give us a brown for the kidney. Where's brown here? Is this brown? Yeah. So the kidney has become swollen. So because of this, you will have the mass in the loin. Okay. So what type of a mass is it? Mass is something that is in the loin. Okay. That is between your lowest ribs and hip. There will be, this mass will move with respiration, and when you use both hands bimanually, you can palpate this mass. It's a ballotable. Ballotable means what? It will bounce back and forth, kind of a mass, and it is smooth and soft. Okay, kidney is smooth and soft. So you can, in one of the clinical features I forgot to mention, there is mass in the loin. Okay, now it is been made in red. So hopefully next time when you're reading the slide, you will not forget it. So you understood this, right? Obstruction to the flow of urine, there's stasis of urine, crystal formation, or all those things, guys, supersaturation and the stages of stone formation. Okay, there is a Randall plaque theory. This is how does the kidney stone form. So there is one Randall plaque theory. Just understand that there is a kidney like this, right? There is renal papilla. Papilla is, the kidney you will draw like this, right? So this portion they're calling as papilla. Here there can be erosion. Okay, erosion can happen in these places. Ulcer can develop, and what will happen whenever there is erosion or an ulcer that develops here, the calcium will come and deposit here. So for calcium, I will bring this color. Minor calcium particles will deposit here, minute concretions, and this will give rise to stone. So this is the Randall, Randall's plaque theory. Okay, what else? So basically, these soft tissue calcification, which is found in the deep renal medulla, it acts as nucleating agent for renal stones. Okay, this is the sentence if you want to write in the exam. Soft tissue calcification found in deep renal medulla act as nucleating agents for renal stones. Can you say that? Okay, you understood the concept. Randall. Then, if there is tubular acidosis, what will happen? See, most stones are acidic, like I think you saw uric acid, etc. Right? So most stones are acidic. So that is why this acidosis can lead to kidney stones. So that is why in treatment they will talk about alkalinization of the urine. Okay. Then, now let's move on. There are some other things in etiology. We're not looking at that. Stages of kidney stone formation, guys. So you looked at the etiology, right? What and all did you see in the etiology? Can you recap? Come on. Kidney stones are formed because of diet. Yes. What did you eat? You ate a lot of, you have vitamin A deficiency. You can have eaten a lot of oxalate foods. Okay. Then there could be immobilization. Then there can be metabolic problems. Yes, here I keep forgetting. What is that? Citrate levels are low. Okay. Then something here, right? Hot climate. Very good. Then, come on. Hot climate, citrate, we told. Infection. Don't forget infection, guys. Then we went to the next slide. Metabolism, hyperparathyroidism, gout, hyperoxaluria, cysteinuria. Then stasis due to obstruction to urine flow, Randall plaque theory, and acidosis. This much you have explained. For causes. Stages, what are the stages of kidney stone formation? Supersaturation, nucleus formation. You saw in that Randall's plaque theory and all, they explained this. That this crystallization, aggregation, matrix formation, and finally there's a stone. Okay, just remember supersaturation, crystallization, etc. Okay, so these are the stages of kidney stones. Guys, you have finished the etiology and stages of kidney stone. Okay, now we have to move to the types of kidney stones, guys. So are you ready to look at the kidney and look at the types of the stones inside it? Ready? Okay, good. So you have 4 things to remember. First one is calcium oxalate stone. You can see that here, it's written in very small font. Then you have the uric acid stone. Here you have the triple phosphate stone, and here you have the cysteine stone. Okay, we'll go one by one, don't worry. Okay, just look at the photos here. I'll just tell you overall if you want. This is what? Calcium oxalate stone. This one is uric acid stone. This one is triple phosphate stone, and this one is cysteine stone. Let's zoom into the first one here. That is calcium oxalate stones. Look at this. This will lead to hematuria. It has sharp edges, right? Sharp projections. It is also called as mulberry calculi. It is a very common type of stone. That is why it's first calcium oxalate stone. Who will have more calcium? Those people will have this type of stone. Who has more oxalate? They will have this type of stone, right? So hypercalcemia, hypercalciuria, hyperoxaluria, these people will have this type of stone. Okay, this is hard and single with projections. Does it remind you of something? Okay, then it produces hematuria. So you can understand, right? So sharp and all. I'm not sure if that is the reason, but it produces hematuria. So it will give dark color. The blood itself gives the dark color to the stone. Okay. Now let's move on. This is radio opaque. Most of them are radio opaque only, guys. So no need to remember. Okay. That means you can see them in the X-ray. In an X-ray, you can visualize it. Now let's move on to uric acid stone, guys. You have already completed one type of kidney stone. Shall we clap for you? Yes. Very good. What are the 3 left? So let us just hold on and write here. You have written calcium oxalate, you have finished. Oxalate is like this, single with projections and all that. Then uric acid, we'll move to uric acid. Then we have to go to this triple phosphate stone. This triple phosphate stone has some other names anyways. Then coming to cysteine stone. Okay, these are the 4 main stones we are concentrating on. Okay, here you have your uric acid stone, guys. Now uric acid stone, look at this, multiple small faceted yellow colored. These are radiolucent. Remember, the pure uric acid stones are actually radiolucent. You cannot spot them on an X-ray. Okay, so guys, what you should understand here, it is uric acid, right? So it is acidic stone, right? It will occur in acidic urine. The risk factors are what for uric acid stone? Uricemia, hyperuricemia. So you will see it where in gout. We already told you that metabolism of purine. There you will see this hypoxanthine, xanthine becoming, did you forget that already? Hypoxanthine becoming xanthine becoming uric acid. This will be, there will be more uric acid in gout. Can you say, yeah, gout. Can you say gout?
Gout.
Xanthine.
Xanthine.
Uric acid.
Uric acid.
Okay, can you say radiolucent?
Radiolucent.
Very good. And can you say allopurinol? Allopurinol. Okay, that's fine. This is the treatment for this condition because gout is also treated with allopurinol. Are you able to see, guys? So allopurinol is the treatment for uric acid stone. So basically this occurs in acidic urine, right? So you can treat it with alkalinization of the urine, right? And you can also suggest these people to have a low purine diet. Guys, these are radiolucent. You cannot spot them on X-ray, right? What else do you have to know here? These are responsive to lithotripsy. They are not that hard, looks like, right? And where and all you see this, you'll see it in people who have gout, Lish-Nihan syndrome, myeloproliferative disorders. So in these conditions, you will find this. Did you understand, guys, or you want us to cover something more? This is radiolucent, remember this, okay? But when can these stones become radio opaque? If they have some mixture of calcium oxalate, etc., they also can become radio opaque. Now we will move on to this side. Triple phosphate stone. Guys, basically, this triple phosphate stone, that means it's a triple phosphate of what and all? Of calcium, magnesium and ammonium. Okay, calcium, magnesium and what? Ammonium. Okay, so this is also called as triple phosphate stone. So these are how? These are smooth and round, something like this. You can see smooth and round. They are dirty white to yellow in color. They occur in renal pelvis and tend to grow in alkaline urine. This is the only unique thing about it. It grows in alkaline urine. So they say this is your kidney. The way it will be is like this. This entire thing will be the stone. See, I will show you. This entire thing will be the stone. Such a huge stone. That is why it is we'll show you the photo. Wait. It enlarges in the pelvis. It grows, that too asymptomatically. It will grow nicely and finally it will cause kidney failure. That time only you will know that it was there actually, kind of a thing. So basically this grows in alkaline urine. Look at the photo. So this is all staghorn calculi. That's why it's called a staghorn. Staghorn calculi. See? The way it takes the shape of the pelvis and the calyxes, right? Staghorn calculi. Dirty white, yellow, and actually the crystal structure is coffin lid appearance. So there's a lot of terminology here that you just learned. Look at this. Triple phosphate stone, triple phosphate of calcium, magnesium and ammonium. This word is important. It occurs in alkaline urine. It enlarges in pelvis, that too asymptomatically, right? And it forms something like a staghorn, also called as a staghorn calculi. This you'll see in women, especially who have recurrent urinary tract infection, right? And this will silently damage the renal parenchyma, and there can be sudden renal failure with high levels of urea and creatinine in the blood. Struvite stone is also the same thing. Struvite stone, staghorn, triple phosphate, all are the same, guys. Are you listening? Especially in these people who have UTIs with Proteus and Klebsiella, that is where all this happens, okay? These stones are so large, that's why when you treat them, you'll have to do all types of procedures called sandwich procedure. You'll have to do percutaneous nephrolithotomy, and along with that, you will have to do extracorporeal shockwave therapy. Unable to write here. Wait. Look at this. PCNL plus ESWL, that is percutaneous nephrolithotomy with extracorporeal shockwave lithotripsy. Both they are doing. A sandwich technique for staghorn calculi, right? These are very big stones. Yay, people, just one more type of stone to go, which we are looking in detail. Look at this. Cysteine stones. These are actually, they are saying, are hexagonal, like, benzene ring. These are because if a person has cysteine in the urine, Especially these stones are very hard. You cannot break them using shock waves and all that. And these have sulfur bonds they have. That's why you cannot break them. They're very hard. Okay. It occurs in people who have what? Cystinuria. And how will you treat it? You'll treat it with alpha mercaptopropionyl glycine, is it? What a name. Okay, then, wait, let me check this. Yeah, that's right, guys. Remember, this is very strong stone, okay? You cannot use shock waves and break it. So many types of stones you learnt, right? If there is one type of stone and another type of stone grows over it, it is called as epitaxy. Epi means above, right? Obviously. The shapes of stones in in microscopy, you'll have to know the crystal structure, guys. That's why we are telling you. The calcium oxalate one that you learnt, right? In that you have monohydrate and dihydrate. Monohydrate is double shaped, dihydrate is like this one. envelope shaped or bipyramidal. Now you are feeling like too much is happening, no guys? Yeah, too much. Anyways, take a break and think, what are we looking at? Renal stones. Very good. What are we looking at now? The types of stones. Yes, types we have finished. But now we are looking at the microscopic crystal structure. For the calcium oxalate, there is double shaped and this envelope and bipyramidal, all this. This envelope and bipyramidal both are same, by the way. So in dihydrate form, you will have this, okay. Now coming to uric acid stone, how it will look, right? Like this. Look, this uric acid stone. It's more like not a proper shape at all. Varying size and shape, they are saying. Rosette shaped, multifaceted these are. That you already knew. Multifaceted is uric acid, that you already knew, right? It's become a lot for it to process. Multifaceted is what? Uric acid, okay. Then coming to cysteine stones. Cysteine stones you already know. Hexagonal, that you already learnt. These are actually hard. Cysteine stones are hard. Then, this one is what? Coffin lid shaped. Triple stone, struvite stone. Guys, there was a mistake in this table. Look at this. The cysteine stones are very hard stones, okay. They've made it hard. And there are so many other types of stones on earth. They're not covering those. Coffin lid is who? The triple phosphate stone. Okay, continuing. Look at this. Some more information about all these types of stones, renal stones. So what did we tell you? There can be xanthine stones. This is a xanthine stone. And what else we told you? See, because of drugs, there can be stones. Guys, focus here. Because of some drugs that a person takes. That means medicines that a person takes, he can develop stones. Interesting, right? That can be Indinavir, triamterene stones, silicate stones. All these are in patients who are being treated with these medications. Why are they being treated? Like they are taking protease inhibitor. That is a antiviral, is it? That sounds more like a HIV drug to me. Potassium sparing diuretic like triamterene. Silicate can be there in some antacids. So these type of drugs, if somebody is taking, they can develop stones. So do not forget, if somebody asks you the cause of stones, we should add that, wait. So drugs or medicines like Indinavir, triamterene, is it? And silicate. So if somebody is taking these type of drugs, they can have renal stones. Okay guys, so did you get it? Very good. So all these are same guys. Struvite is same, tips is same, that is triple phosphate stones is same, staghorn stone is the same. So these three names are all the same names, okay. Then let's move on. We have looked at all the types of stones, haven't we? So which are the radiolucent stones? So that means you cannot spot them on an X-ray. If they are pure uric acid stones, you cannot spot them. Whenever you say uric acid, you will say xanthine also. Okay, remember if you want acidic stones, you know already uric acid is an acidic stone. Okay. Now, alkaline, did you see where it is? Look at this guys. Alkaline comes only in this triple phosphate so far. Very clearly it has come as alkaline. So if somebody asks you acidic, uric acid, acidic, cysteine also I think acidic. And what about this calcium oxalate also acidic, is it? Yes, in all those four that we saw in detail, most are acidic. That's why they'll say renal tubular acidosis will lead to kidney stones. Very good. So now, so far we have reached. Now what will happen if you do not treat these renal stones? We already told you that if it is a staghorn calculi, those people will be asymptomatic though the stone is so huge, and finally they'll land up with uremia, and that will, they can possibly come up with renal failure. Okay. Then they can have hydronephrosis. We already told you that urine backflow, etc., urine enlargement, mass in the loin, right? Pyonephrosis, pus, right? Infected hydronephrosis. So kidney is converted into a bag of pus. You'll have to drain that pus and all that. Then they can develop carcinoma, guys. A long-standing stone increases the risk of carcinoma. So just take a minute, and what are the complications you looked at so far? Because of kidney stones, what are the complications you looked at? Yes, hydronephrosis, pyonephrosis, renal failure, and carcinoma. Yes, very good. Then what else? That's it. Some people are saying septicemia. They can present with hypertension. They can have ureteric colic, all that we saw. Okay, anyways. So far in this video, we just looked at a high level overview of renal stones, renal calculi, etc. Bye bye, guys.